معنا اليوم دكتور لايكوفر، أخصائي جراحة العظام في مستشفى ميموريال هيرمان ميموريال سيتي في هيوستن تكساس. بدي أعرفكم عليه لأنه دكتور ما بيوفي الشرح عنه أو وصفه. الحقيقة دكتور ذكي جدا، ماهر جدا في عمليات اللي بيعملها، وبالأخص عمليات العظام طبعا. 29 سنة من الشغل الدؤوب. بحييه وبرحب فيه معنا في حديث مباشر معاكم. إن شاء الله تنبسطوا. Dr. Larry Likeover, how are you?
I'm good. How are you?
It's always good to see you.
Thank you.
We want to talk today about a few different subjects, if we can. Can you please first tell us a little bit about yourself?
Sure. I grew up in Cleveland, Ohio. I went to medical school at Baylor College of Medicine here in Houston. Did University of Texas orthopedic internship and residency.
All right. How long you've been practicing?
39 years, 40 years in
Oh, mashallah.
July.
Okay. I said 29 years a minute ago, فبدي أصلحها. هي 39 سنة من الممارسة لجراحة العظام. ما في خبرة أكتر من هيك. You look very young, Dr. Likeover.
For 39 years in practice, yes.
This is wonderful. As you know, you see a lot of our patients coming from the Middle East.
I
and,
do.
And we really thank you for always giving us the chance to be on your schedule. And we know how busy you are. I just want to ask you a few questions today. Our patient comes with a lot of pains. And what I want to know from you, how do we differentiate the pain? If I'm having... after exercise, if I keep having pain in my knees, is it the same as the pain I would have if I'm walking? When would I think that this pain is different and I should do something else?
Well, the question is if you have pain walking, pain running, or pain with no activity at all. A big part of it is whether your knee is swollen. And basically on exam, the doctor has to examine you. But the most important thing is an x-ray with you standing on your knee. If the x-ray shows you're bone on bone, that means you probably need some type of replacement of the knee. If the x-ray is good, you likely need an MRI to see if it's a meniscus tear or ACL tear or other internal problem of the knee if the x-ray is normal.
So for the ones that the cartilage is totally gone, is it the x-ray that diagnoses, not the MRI?
You don't need an x-ray if you're bone on, you don't need an MRI if you're bone on bone. Bone on bone. Basically, you're either bone on one side of your knee or the whole knee's bone on bone.
I see.
If one part of your knee is bone on bone, you may just need a partial replacement. If more than one part of the knee is bad, either the kneecap joint or the other side of the knee, then you need a total replacement.
All right. So a lot of our patients, they don't know when it is the right time to do the surgery.
Yeah.
So when do I think that it is the right time for me to do the surgery?
What I tell patients is when you're tired of the pain and you want to get it fixed, you're ready to do surgery. Until then, you can take anti-inflammatory pills, you can do cortisone shots, you can do what people call Halogen or rooster comb injection. Those are the three non-surgicals, shots and pills.
So they can do this over the years until they give up on all of this?
Right, until they're tired of the pain or the shots and the pills become ineffective.
I see. I have a question for you about the lengthy wait of replacing the knee. Like, if they overdo it, isn't it? It changes something in the posture or something on the hips. If I'm right, can we touch base on that?
I don't know what you're speaking about.
Okay.
Pause for 1
Pause.
second. So, up here, could
Remember
we
our
just
patients when they
adjust your
waited
hair
for
just a
too
little
long?
bit?
They waited for too long and it twisted, it curved. Remember Mr. Al-Kitbi? How his knee was like kind of like that, and he had his knee in pain for so long.
Well, it just gets more bowed.
So, Dr. Likeover, for a patient who needs a total knee replacement, you offer something different called the signature knee replacement, and I see that all our patients who had done the surgery had really great results, and it was way more than what they expected of those results. So can you explain to us a little bit more about the signature knee replacement?
A signature knee is a custom-designed, MRI-designed knee. What happens is the person with the bone-on-bone knee undergoes an MRI to measure the shape of the femur and the tibia and the alignment of the leg. The MRI actually goes from the hip and down through the ankle. So then on my computer, I get the results. I design the knee replacement, and it's manufactured in a factory. It takes about 4 weeks to have it ready, and it's a custom designed, custom aligned knee replacement.
So it is less pressure and intense during the surgery that makes it comes more fitted. Is that one of the advantages?
It fits the patient perfect, and it's designed to give perfect alignment of the knee, which orthopedic surgeons think will give you a better result with less pain and stiffness in the knee.
And can we do 2 knees in a short time?
We can do 2 knees in a short time. Most patients are not healthy enough to do 2 knees at one operation. We usually separate them by 10 days or 2 weeks or 3 weeks, and it's less complicated to separate them a little bit.
And how long they need to stay for physical therapy?
Well, that's a good question. I do have a lot of patients that go back home in a week or 2 days, but ideally staying in Houston 3 to 6 weeks is perfect after a total knee replacement.
So you advise of physical therapy is a must after total knee replacement?
Yes, after knee replacement, physical therapy is a must. After hip replacement, it's not as important, we've learned.
All right. So we're going to talk about hip replacement since you mentioned it now. I know that there is the traditional hip replacement. I want to ask you again, when is a person needs to do a hip replacement? What is that he comes you with? What kind of complaints?
Most people have terrible pain. They can't walk very far. They either have groin pain or pain in their butt. Most people can't sleep at night. They have trouble turning over bed, but most commonly they can't walk very far, and it's just really causing a deep, deep pain that keeps people awake at night and is very uncomfortable.
And I know that we're advising a lot of our patients to do the frontal hip replacement. What is that?
It's called an anterior direct hip replacement. We go through the front, make a smaller incision than you do through the back. We don't cut any muscles, and we replace the hip through a direct anterior approach.
That's why our patients heals really fast, and they leave the country really fast. So does hip replacement need physical therapy as
Actually, it's been shown now that hip replacement doesn't really need physical therapy. Hip replacement patients can get well just by doing lots of walking. The more a hip replacement patient walks, the better. So physical therapy is not mandatory after a hip replacement.
Okay, great. So what else do you advise in reference, or you want to tell us about the hip replacement? Precautions after surgery. Is there any precautions they need to do? Can they run? Can they climb?
They can climb. We really don't recommend running after a hip or knee replacement. You can do all kinds of exercise, walk, stationary bicycle, elliptical, but neither a hip or knee replacement is really made for what we call high-impact sports such as volleyball or basketball or running distances. You can run a few steps, but it's not advised to run miles.
So we talked about total knee replacement. Some of our young generation, I noticed that they come with different injuries, but others you recommend for them partial knee replacement. When do you decide it's a partial knee replacement?
That's a good question. Most commonly, a partial knee replacement of the weight-bearing joint is when you've had a meniscus surgery after an arthroscopic surgery and one side of the knee goes bad, usually the inside or what we call the medial side of the knee. When the medial side of the knee goes bone on bone and the rest of the knee is excellent, you can do a partial knee replacement. I do what's called an Oxford unicompartmental knee replacement. It's a much quicker, easier operation than a total replacement, but it's only indicated if only one part of the knee is bad, and as I said, most commonly it's after you've had your meniscus removed with arthroscopic surgery.
So how do you diagnose the partial knee replacement? Is it X-ray or MRI?
No, basically it's weight-bearing X-ray with the knee bent 20 degrees. You can see if a person's worn out on the inside of the knee. An MRI is not required to diagnose the need for a partial replacement. There's also a group of patients, usually women, who wear out their kneecap joint. We call that patellofemoral arthritis. Those people get a patellofemoral replacement, which is a much easier operation than a total replacement. So you just got to have a bad kneecap or patellofemoral joint for that, with the rest of your knee, the weight-bearing joint, being normal.
And how long is recovery from such surgery?
That's a quick recovery. That's about 6 or 8 weeks and you're good.
All right. And does the partial need physical therapy as well?
Partial replacement needs physical therapy.
What kind of physical therapy usually is good for knee replacements? Is it the bike? Is it the...
Stationary bike, Stairmaster, range of motion exercise, weightlifting machine for both hamstring and quadriceps muscles.
And when we do the partial knee replacement, can people bend their knees after?
Yeah, we want them to bend their knee all the way. Full bend, full straight, walk on it right away, off crutches as fast as possible.
All right. I know recently here at Memorial City, I think it's been like 3-4 years that we have a great orthopedic center where all your ORs and
Right.
is there. Can you tell us a little bit about it?
Well, we built a specially orthopedic operating rooms and special orthopedic floors where all the nurses are orthopedically trained, and the OR is strictly orthopedics, so we have special trained orthopedic nurses and surgical technicians, and the patients are not exposed to all the other type of surgeries that can go on in an operating room that can cause infection. So the colon and rectal patients are not there, the female patients are not there, the ear, nose, and throat, anything that has bad germs potentially that could contaminate an OR is not present in our orthopedic operating rooms. They're strictly orthopedic. A total knee replacement is necessary when you're bone on bone in more than one part of the knee. This is what a total knee replacement is. It's basically a recapping operation. You're going to cover the worn out end of the bone with titanium. On the other bone, the tibia bone, most operations you get a tibial plate and a polyethylene pad. We're now telling patients that this pad will last 20 to 30 years. So you have a new pad to walk on supported by metal on both sides that really should last a long time. In addition, the kneecap is replaced, so when the knee bends up and down, the person's kneecap is protected. So all surfaces that rub in a knee are replaced in a total replacement.
People comes with injuries of shoulders and people comes with pain that is not related to injury. So when a patient needs a shoulder replacement?
Okay, shoulder replacements fall in two groups. There's one called primary arthritis where the shoulder wears out just like the knees wears out. In that case, we do what's called a standard or anatomical shoulder replacement. We replace the ball and we replace the socket. More commonly, there's a lot of patients that have torn their rotator cuff and either never had their rotator cuff fixed because it was never treated and never diagnosed, or they had rotator cuff surgery, either open or arthroscopic, and that surgery failed. And people with a failed rotator cuff surgery can now be helped with what we call a reverse total shoulder replacement, which was developed about 10 years ago, and we didn't have any treatment until 10 years ago for people with failed rotator cuff surgery. So we can now fix patients that have no rotator cuff and give them normal function of their shoulder, and we can fix the patients quite easily that have just simply worn out shoulders with what we call a standard replacement.
Does the surgery address their pain? Are they free of pain in a short time or it takes longer?
Very quickly. Shoulder replacement patients are very happy with pain relief. That's the main reason we do shoulder replacement surgery is pain. And in the case of reverse shoulder replacement, we do it for loss of the ability to raise your arm up.
Right, right.
What we call pseudo-paralysis.
And do they get their range of motion and all after the shoulder replacement?
They do. It's amazing what can be done for people who cannot raise their arm with a reverse shoulder replacement.
Yeah, I saw a lot that they cannot even go more than this.
They can't go
for
more
years.
than halfway, right.
Right, and it's how long they can wait on that. Because I noticed there's a lot of people or patients when they come to us, they have a frozen shoulder for so long
Right.
that they did not address. How long you can go along with this?
Well, I mean, frozen shoulder is a different problem, but a person who lacks raising up their arm, we like to fix them within a year when they develop paralysis.
I see. Dr. لايكوفر, we really enjoyed talking with you today, and I want to tell you that all your friends and families in the Middle East, from Qatar to Saudi Arabia to Kuwait to Emirates to all over, they're saying hello to you, and they're really waiting on this interview with you. So I really want to thank you for taking care of them.
Masalama.
All right. مرحبا، أنا عبير صقر. بحب أعرفكم عني شوي لأنه بيجيني أسئلة كتير على إيش محيط عملنا. أنا موجودة بهيوستن تكساس. تابعين لمركز رئيسي كبير وخبير جدا اسمه ميموريال هيرمان ميموريال سيتي ميديكال سنتر. عندنا شبكة طبية للأطباء مختصة جدا بعلاج المرضى في كل أنواع التخصصات. طبعا تخصص أورام السرطانية والعصبية وتخصص الجهاز المناعي والسكري وغيره أحد أعظم التخصصات اللي موجودة في المركز. عندنا فريق متكامل من مترجمين ومن منسقين، وبوجودي أنا طبعا بنناقش كل حالة طبية بتوصلنا، بنطرحها على الطبيب المختص أو القسم نفسه كله المختص، بناخد رأيهم فيها قبل ما يجي المريض عنا. بالتالي بيكون عنا فكرة عن خطة علاج المريض، عنا فكرة عن المدة اللي ممكن ينتظرها في البلد هون علشان العلاج. بننسق للمريض حضوره، بننسق معاه برنامج رعاية وهو موجود هنا في هيوستن معانا. في كتير أوقات بيكون الناس معهم أهلهم وناسهم، وإحنا طبعا نتشرف بمعرفة كل الناس وبنساعد قد ما بنقدر. أهم شيء في علاقتك مع طبيبك، بحب كل مريض يكون عارف، أو كل إنسان بيزور طبيبه يكون عارف إنه أنت إلك حق إنك تسمع المعلومات اللي أنت بدك إياها من طبيبك، إلك الحق في الوقت اللي أنت بتقضيه مع طبيبك، إلك الحق إنه يسمع قصة حياتك برضو طبيبك، مش بس إنه يقولك تشخيصك ويقولك إيش لازم تعمل وإيش ما لازم تعمل. إذا ما بتقدر تتناقش مع طبيبك، إذا ما بتقدر تاخد وتعطي معاه أو تلاقيه في الوقت اللي أنت بتحتاجه بالشدة وفي الضيق وفي التعب، معناته طبيبك مش هو المناسب إلك أنت. لازم تحط نفسك بالأول وأي شيء تاني من خلفك. خبرتي كتير كبيرة مع الناس، خبرتي كتير كبيرة مع الأطباء، وبحب أن أنتوا تستفيدوا منها، وأنا بتمنى أني أفيدكم فيها. أنا بدأت في المجال هذا، وأول ما تخرجت من الجامعة اتزوجت وعشت بهيوستن. وسبحان الله الدنيا تغيرت كتير وعلي من انتقالي من بلدي لاني اعيش هنا بهيوستن. وكان توجهي فعلا انه انا بدي احاول اشتغل في مجال اساعد فيه المرضى. انا اخصائية تغذية وعلوم صحية، فكان طبعا صح لي الشأن اني انا اقدر اشتغل في مركز متخصص بالاورام السرطانية، وقدرت اني انجح واتطور في المركز هذا. بس اكبر شيء خلاني انجح واتطور هي علاقتي الحميمة مع الناس ومع المرضى ومع الاطباء. هي من اهم العلاقات اللي موجودة في حياتي بعد علاقاتي طبعا مع عائلتي، لكن حبي للناس وحبي لمساعدة الناس بتدير حياتي بشكل كتير كبير، لانه بيهمني اني انا اساعدكم، بيهمني أساعد اللي بيلجأ إلي، حتى لو التخصص ما كان عندي، حتى لو الأمر مش عندي، لو بقدر بالإرشاد والتوجيه أقدر أوصلهم لشيء هم بيرغبوه. فبتمنى أنه أنتوا تتواصلوا معنا دايما. أتمنى أنه اللي إحنا بنعمله على السوشيال ميديا مستفيدين منه، هو إخراجه كتير بسيط على قد حالنا، لكن بحب أسمع منكم أسئلتكم، بحب أسمع منكم اقتراحاتكم كيف فينا نطورها. قد ما بقدر رح أطورها، الوقت ضيق بيكون. عموما انتوا دايما بتشرفوني وانا بحب كتير اسمع منكم. Thank you. انا بحبكم كتير وبحب اساعدكم. كل اللي بقدر عليه ما رح اوفره عنكم. اسألوني واطلبوا مني ورح اشوف انا ايش بقدر اقدم لكم. بحبكم تتعلموا من خبرتي وبحب افيدكم منها. تحياتي لكم جميعا، وانا موجودة في حالة تحتاجوا تتواصلوا معي.